Dr. Cheryl Lee is here now from The Ohio State University talking about overcoming some of the health disparities in urologic research. Can you outline what some of those challenges are?
Well, to begin with, our field has had the challenge of health disparities across many of our specialties. In oncology, we're dealing with disparities in outcomes, disparities in the consumption of treatments, and disparities in how patients are counseled, even. In the world of female urology, there are disparities related to incontinence. In pediatric urology, there's disparities related to circumcision. So I say this to show that across our field, we're dealing with potential inequities in care, and certainly inequities in outcomes. So one of the ways that we can address disparities is to create research models that can test various hypotheses. This is what we do. Normally, our research is focused on developing new treatments, new paradigms, new strategies, new initiatives, and we have the tools to test those strategies over and over again. Whether we're talking about translational research and looking at animal models or cellular models, whether we're thinking about clinical trials and various phases of study, whether we're thinking about health services research and we look at numerous administrative data sets and approach those data sets with various statistical models, or whether we're thinking about population health and community-based research, where we're moving from community to community to community to address the questions, concerns, and challenges that individual populations face. So we have a track record of identifying a challenge, creating a fundamental structure to study that challenge, but in an iterative fashion. And now we are struggling with the fact that we don't have those same models to study healthcare disparities.
When you think about the research into new treatments and new care protocols, that has been so critical. But unless you address the inequities, that's going to change things clearly for patients and their healthcare providers. What is the greatest benefit, do you think, to focusing on this as something that is paramount in terms of importance?
Well, as a society, healthcare is very expensive. And being unhealthy relates in a great loss of productivity and a great loss of potential. So it is to our advantage to have a healthy population.
So if you had one recommendation to researchers to begin to make an impact when it comes to health disparities, what would it be?
Collaborate and demand the information that's needed for us to look at the situations that may trigger and lead to disparities. Social determinants of health, for example. How do the social determinants impact cellular structure? How does that impact disease and treatment resistance? We need to ask these questions, and we need to create the models, be they cellular models, be they preclinical models, be they approaches to modeling clinical trials with relaxed eligibility criteria, with health system strategies to improve representation, or community-based models to engage patients and understand what they feel is important and what they need. We have to create those models to address the questions that will then hopefully lead us to that iterative process of hypothesis generation, trial and error, and coming up with real strategies to reduce disparities.
Well, Dr. Lee, it's going to be a journey, but you are beginning the process in the right direction. Thank you.